Hi, I'm Scott Flanders, Chief Clinical Strategy Officer for the University of Michigan. Michigan Medicine is focused on developing the country's most consequential academic health system, and a key component of that work is all of our effort around clinical integration across the core of our statewide system. Today's Short Takes episode highlights the Telehepatology program and some of the exciting clinical integration happening between Michigan Medicine's Academic Medical Center, University of Michigan Health Sparrow, and University of Michigan Health West. The Telehepatology program reflects our broad commitment to providing patient-centered care, increasing access to that care, improving our clinical outcomes, and advancing health for patients across U of M Health's statewide network and beyond.
Telehepatology is a virtual inpatient consultation service that's designed to extend the AMC's transplant hepatology and other expertise to its partner hospitals. This innovative program functions as an extension of local care teams, and it provides timely, specialized guidance for patients with complex liver diseases, and it allows their care to remain close to home when that's appropriate. Access to specialty liver care directly impacts quality of life, transplant eligibility, and survival. And by offering these virtual consultations, we're able to assess patients more quickly and, as a result, respond more effectively to their complex care needs.
The Telehepatology program brings together multidisciplinary experts from hepatology, surgery, psychiatry, and transplant teams to provide a collaborative care model. Our AMC team works in partnership with local gastroenterologists, offering management support for a range of liver conditions, including abnormal liver tests and imaging, decompensated cirrhosis, acute liver failure, acute on chronic liver failure, and portal hypertension complications. In addition, the team provides guidance on key aspects of patient care, such as diagnostic evaluation and testing, discharge planning and follow-up pathways, liver transplant evaluation and triage, pre-transfer optimization and transplant readiness, and bridging management strategies.
So acutely ill patients admitted to our ICU and our hospital can now access world-class expertise care for transplant. Previously, these acutely ill patients would need to improve to the point where they could get to Ann Arbor for evaluation. And now we're able to bring them a telehepatology evaluation so that they can get some answers to critical questions and potentially access life-saving therapies. Here in Grand Rapids, when patients have barriers to care, oftentimes it's transportation or community and family support. And by allowing the telehepatology program to sort of drive their evaluation locally, it improves engagement of that family support. Even if transplant is not the eventual outcome, that patient can then stay embedded within their family during times of acute illness. And if transplant is the outcome, we know that the family's engagement helps to provide better outcomes after transplant.
Telehepatology allows our local teams to connect directly with the transplant hepatology specialists at the Academic Medical Center without transferring every patient. This helps us ensure patients receive consistent expert recommendations while staying closer to home whenever possible. It gives our providers here at Sparrow access to highly specialized liver expertise that may not otherwise be available locally. This allows us to make more informed treatment decisions and identify patients who may benefit from advanced therapies or transplant evaluation.
The telehepatology team has completed 31 consults to date, of which 21 were telehepatology and 10 were telepsychiatry consults. 10 patients were transferred to the Academic Medical Center for full transplant evaluation, 3 of which have been successfully transplanted, and 1 remains actively listed. We're seeing early evidence of avoided and optimized transfers, allowing patients to remain at their local care sites, close to their families, when safe and appropriate, and ensuring that patients receive the right care in the right place at the right time.
Thank you to every team member who has contributed to the success of this collaborative care initiative. The Telehepatology program is just one example of the amazing things we can achieve when we work together to put patients first and advance health to serve Michigan and the world.